We are at our, are we picking up? I apologize for having to start like this. It was bound to happen at one of these. Okay. We are at our 5 o'clock update on the coronavirus. We're going to come to you with these each and every day, and there may be some days we have a little audio difficulty, or maybe it's just my own difficulty. Folks, I'm going to be here each and every day. I'm going to make sure that we get through this and we get through it together. Let's start like we always start. We're going to make it through this. This is disrupting our lives and disrupting our country and our Commonwealth like nothing that any of us have ever experienced. And that disruption may get greater before it gets less. We may go through harder times before we come out on the other side, but we can do this. Now, as we look back in history, America has faced great challenges, and we have always risen up to meet them. And if there is a blessing in this challenge we face, it's that facing it is all about us doing it together, about us being good citizens, good people, coming together, looking out for the most vulnerable, and doing everything we can for each other. As Kentuckians, I know that we can pass that test. And let me first address, I know that there is nervousness out there. And nervousness ends up creating rumors where people get really worried that there's some National Guard lockdown that's coming tomorrow. Folks, there's nothing remotely like that. So when you hear those things, breathe. And know that I'm going to talk to you every day at 5. I'm going to be transparent with you like we always are, and that you can always get the right information from me by our website, and that in these times, make sure you have good sources of news. Good sources of news aren't sources that scare you. They are sources that inform you. And also, make sure that you turn it off too. You know, to get through this in the mental and the physical shape that we need to get through this means you have to turn this off at different parts of the day. So we're going to start with good news. Good news means we show the types of good modeled behavior that we need people doing. People taking care of each other and people taking care of themselves. So I know we have some more social media that we're going to show today of the types of things that we need to see. All right, I love this one. So many people out there are working so hard to provide meals for those that might be getting them at school. And while we all know why we do that, these 3 kids wrote thank you notes to the people who were bringing them. This isn't just the type of modeled behavior that we want to see out of those that are working to provide. This is the type of behavior we want to see out of our kids. These 3 kids, I want to thank you. And then I want my kids to watch what you're doing and learn to write thank you notes. Let's go to the next. All right, so here we've got folks doing what they need to do. You need to keep your kids on a schedule. You need to make sure that they are continuing to engage in learning like they would in school. And the great part about this is you got a family, and as you notice, you got the 1-year-old in the background that's already trying to model that positive behavior of the kids in the front. Remember that while there are difficult times getting through what we will have to go through, take those moments with your family. They are critically important, and enjoy every single minute of extra time you have with them. Let's go to the next. All right, so these are folks that are doing everything they can to help make sure, especially our kids, have the healthy meals that they need. Thank you to all our food banks, our schools, and everybody else that's out there stepping up. This coronavirus is a test of whether we can truly be a great neighbor to each other. And you know, most Kentuckians are passing that test. Let's go to the next. So, this one is both happy and a little sad. It's this little girl can't see her grandparents right now. It's about the social distancing we need, especially to protect her grandparents, those that are most vulnerable to this virus. But what I love about this is in a world of modern technology, not only do we have the chance to FaceTime and do other things, we have more opportunity to actually keep our connections, even when we have to stay apart from each other right now, than ever before in our history. That should help us rise to this challenge. But there's still the everyday things that we can do in Crayon that those that we love are going to love just as much. Let's look at the next one. All right. Again, these are folks that are providing meals, the types of behavior that we need to see. Today in Shelby County Public Schools, 2,968 meals to a little over 1,400 students. Incredible work by Shelby County. Again, we see not only the learning we get in home, but we see a little bit of the home that we love so much. Keep going, Kenneth. All right. Again, we've got the curbside pickup that we need people out there to be using. Our small businesses, especially our restaurants, have been hit hard. We need you to make those orders. Today, we're going to announce a little bit later that we're also going to allow in-delivery, alcohol delivery from the restaurants and bars that are continuing to deliver. We're going to do takeout tonight with my family. Just a couple other examples of how, despite teleworking and social distancing, we still have amazing moments with those we love. All right, so we can also still get the physical activity that we need. We can continue to do some of the things that our kids love while engaged in social distancing. On the left, you got some baseball practice, making sure that you have that great form. This is something my son and I are doing together, though he's pitching right now. And on the right, something that my wife certainly loves, Pure Bar. And after that, our dogs are certainly tired too. I love this one. This is one of our senior care facilities. Can't necessarily get the interaction that would normally happen with family, but finding ways, even with social distancing, to connect to one another, to be there for our Commonwealth. Okay, and this is the last one, and I included because it's a call for action. We don't need every Kentuckian to respond, but Greenhouse 17 is a shelter for those that need our help, and they need a little help. So those watching, make sure that we do what we can to help out those that would normally get in-person donations, but that we have other opportunities. Good. Can you put up the hashtags, Kenneth? Again, as we go forward, we want to make sure that we are populating social media with the type of positive news and good behaviors that we need to see out of everyone to come through this with our mental and physical health intact, but also to make sure that we have the social distance from others to make sure we are not spreading this virus. When you do those things, we're asking you to put it on social media with the hashtags Team Kentucky, Together Kentucky, and I've asked to add a third one, and that's Patriot. Because we are in a time, folks, where it is our patriotic duty to follow this guidance, to make sure we are not spreading this virus. And when you think about all the sacrifices that people are making, businesses shutting down, kids out of school. I mean, there are significant sacrifices. We are changing the way we've lived our lives for my entire lifetime. It is a patriotic act, and it is our patriotic duty, and we ought to acknowledge that. A couple other pieces of good news. Our YMCAs are truly stepping up to help on childcare, especially for our frontline healthcare workers. We are extending exemptions that right now we have to child care to make sure we are also getting our police, our firefighters, our corrections officers, and our DCBS workers that need to be out there protecting our children. Also want to really thank some plumbers and pipe fitters out there. Today I put out a call for industrial respirators. They went to work and have already rounded up a significant amount every single time that we make an ask. Kentuckians respond. And today, while they are not fully ramped up, we have at least 8 different labs that are providing testing in one form or fashion, and we hope to see more as we go forward in Kentucky. Next thing I want to turn to is I know a lot of you are out there, whether your small business is closed or whether you've been laid off or not working during this. I just want to go over a couple slides on how to get help. The first is unemployment insurance. As you're aware, we've been talking about this every day. We have significantly increased our capacity. We have a schedule that is on our website, kycovid19.ky.gov, about when people should get online to file based on their last name. Kenneth, can you bring that one up too? Let me say, we want everybody who qualifies for unemployment insurance to file. There's no stigma. These are times like we have never seen before. We want to do everything we can during this difficult time to make sure that you can get what you need. Here's the schedule. Please abide by the schedule. No one will be penalized for waiting for their day based on when they may have lost their job. To those that right now we're small business owners, independent contractors, we are working to make sure that we can provide for you as well. We believe once the SBA accepts our requests for small business loans, you will qualify, but we are also working on additional steps to help you that we hope to announce next week. I know that there's a little bit of wait, but we got to get approval for what we do, and I want to make sure that I can always tell you that we can provide help when we do. Also, Kentuckians are going to need benefits. Let's put up that slide if we can, Kenneth. Again, through this difficult period, we want everybody who qualifies for Medicaid to sign up for Medicaid. This is an international health pandemic, which means we need everybody out there to have the health care they need to respond to it. This is a time when everybody should be encouraging health care and providing everything we can to make sure that you and your family can have the benefits that you need. Also, the other programs that are up here, we want to make sure that you can get qualified. You go to the next slide, Kenneth. So this is how you can apply for benefits. This will be up on our website. We're going to be able to do it all remotely. These are things that you are going to need for that application that you should gather. And then there's one more, I think, Kenneth. There we go. Here are the numbers for Medicaid and for assistance programs. Folks, make sure you use it. And while I say that, I know that there are so many who need help that there are going to be waits. You're probably going to have to sit on hold longer than you should have to. There may be a time when a server goes down and we got to get it back up. Please have patience with us. I know that's hard in a time of anxiety, but this government and I want to be here for you. We've never faced anything like this before. I want to help every single person out there get through it. Do not be, whether it's too proud or anything else, to sign up for these benefits. Please get them. All right. So now we're going to go into our update for today on new cases. And this is one of those times where we're going to have to breathe a little bit. We know that we're going to see new cases every day. We know we're going to see challenges out there, and we got to be ready to take it. We are a resilient people, and we're going to make it through this together. So now that we have different labs that are coming in, it's a little bit harder at any given time to give exact numbers, but we believe as of tonight, we have approximately 47 positive tests that are out there. And we also believe that as of tonight, we are reporting the second death related to the coronavirus. Again, these are announcements that you never want to make, but more importantly, this is an event a family never wants to face. This was a 64-year-old male from Jefferson who actually passed away on the 13th. but the testing has now come back. There are a lot of factors that contributed to it, and this individual fell into that vulnerable population, which is why we are doing the social distancing and taking the steps that we need to. We also have what I believe is a 6-year-old that is tested positive as well in this group in Jefferson County. Kenneth, will you put up the graph by age? Now, I want to go over this again because as a parent, hearing about children testing positive for the coronavirus can be scary. It can be scary. So what we have talked about, and I hope that I've been clear, isn't that kids can't get the coronavirus. It's that they are exceedingly resilient to the coronavirus, that their systems, from everything we've seen, take it on, and they show little to no symptoms. And even when they get sick, they have been very resilient towards it. Let me first say that both our 8-month-old and our 6-year-old are doing well. They're both getting care. One is at home, one is in the hospital, but just general admission to the hospital. And in the United States, this was at least accurate as of yesterday. We haven't had one individual under 19 years old even admitted into the ICU, much less facing something more difficult. So, as a parent, I know it's hard to hear that we've had a second test of a child. It's not that our children can't get it, it's that they are exceedingly resilient to it, and we haven't seen negative outcomes in this country yet at all from these children. But it should show you why we've taken the steps with schools and why we've got to engage in that social distancing even with children. It means that you as a family ought to be a close unit, but we have to keep our distance from other people as we move through this. I'm going to give just an update about the demographics that we have. And this was as of when I gave the original ones in yesterday's conference because we learned about other ones. And so at the beginning of yesterday's press conference, we had 28, though one was a New York resident. We just received it in Fayette County. So the additional ones I can give you are a 27-year-old female from Clark, a 51-year-old male from Davies County, a 26-year-old female from Fayette, a 61-year-old female from Franklin, a 50-year-old male from Harrison, a female from Henderson, a 66-year-old female from Kenton, a 59-year-old female from Pulaski, a 73-year-old male from Warren, a 61-year-old female from Christian, another female from Fayette, a 45-year-old female from Jefferson, and a 46-year-old female from Jefferson. Now, there are some additional cases that we don't have the demographics that we've talked about. But as we go, and as we expect to see more cases, we're going to have a little lag in some of the numbers and some of the demographics. Now, I get that it seems like we're having more cases, and we are, and that's expected. Kenneth, can we show the Philadelphia versus St. Louis slide? I tell you what, let's show the line graph instead. I know you all have seen these a number of times, but I think it's important because we're still operating under the same plans and the same set of facts that we talk about them. Remember, if we don't reduce our contacts, and that's why we're taking these steps, that business as usual line is a whole lot of cases and more people that we love that are in harm's way. If we reduce them like we're asking to, that's why we have closed restaurants and bars, and that's why, as we talk about later, virtually every gathering is going to have to be prohibited as we move forward. We need to get as close to that red line as possible. But in our expectations and how we approach this, notice that just about every line on this line graph still goes up for a period of time. And if we look at the Philadelphia versus St. Louis, this is the other example that we've been using. Again, this deals with Spanish flu, which we believe was much deadlier than the coronavirus, and we didn't have the same healthcare system in place, and we didn't know what we know. Even if we can be St. Louis, which is what we're trying to do each and every day, there is still an increase of cases before there is a decrease of cases. So remember, the number one thing we need to do as citizens is first, remain calm. This is expected. And number two, make sure we are following all of this guidance. If we follow the guidance, we engage in social distancing, we are good citizens, then what we want to see is the increase, which is going to happen, ultimately be followed by a decrease, and then we're going to have to stick with it. So the biggest challenge we're going to face after the increase starts to go down is perseverance. We got to get this right the first time. Notice on the St. Louis graph how it goes back up again. We don't want to see that. We want to make sure as we work through this, after we deal with the increase, when we finally get to the decrease, that we beat this coronavirus on our very first try. All right, I'm going to very quickly, because I do it each and every time, go over the steps that we've taken. I think the routine is important for all of us, and it creates the right sense of normalcy that we've taken steps, and we're going to take some more steps. We declared a state of emergency. We're using those powers every day to help you and every other Kentuckian. We've activated the Emergency Management Operations Center. It's on level 3. It is letting us do the type of planning that we need to do so that, for instance, when we have the capabilities of doing drive-through testing, the moment that we have those resources, we'll be able to do it on as short of notice as possible. That planning is going on right now. My goal is to get to the point where everybody wants to get tested for any reason, can get tested, and we're working towards it. We're not there yet, and until we get there, we got to make sure that the sickest among us get the vast majority of those resources, because remember, for most of us out there, we'll be just fine with this thing. It's everybody else that we've got to be looking out for, but to those that are still flocking to places and crowds, what you do is you transmit it. And you transmit it to people who can't necessarily deal with it like you can. Then we're actually seeing bigger numbers of folks that are maybe even below 60, and I believe that's because they're not taking the advice and the guidance. We activated our State Health Operations Center. We announced our hotline, 1-800-722-5725, 1-800-722-5725. Our website is the source and place to go, kycovid19.ky.gov for real information. If your friend is telling you that the National Guard is about to close down the state, folks, that is not real, and that's fear. That's what fear does to us. And remember, we have two enemies in this thing. One is the coronavirus, and the other is fear. And we got to defeat both of them each and every day. It's not easy, but it is our job as Kentuckians and as Americans. Our website looks a little different. We're trying to upgrade it. It has a new URL. It is still our website. It is not a copy. You can rely on it. It has the information. If you are told a rumor, go to our website. If it is not on the website, it is not true. We have an executive order prohibiting price gouging. If you see price gouging, dial 888-432-9257. We've issued an executive order, and we're working with Medicaid. We want to make sure that the testing and the ultimate treatment of the coronavirus is free. That is where we're pushing towards, and that is where we are going to get. We're working with all 120 county judges, and we're going to continue to. We've had to restrict visitation to long-term care facilities and nursing homes. I know that's hard. As you see now, it's necessary. We signed an executive order for pharmacies to refill your prescriptions. We're going to make sure, as long as this takes, that you don't have to go back to your doctor just to get a routine prescription updated. We've closed all state prisons to visitors. We're recommending social distancing to everybody. You've got to do it. It is your patriotic duty. This is how we defeat the coronavirus. We're calling on you as Americans and as citizens of the Commonwealth to do your part, and that means to follow the guidance, stay 6 feet away, wash your hands, engage in good hygiene. Do not be the one person that frustrates it and continues to spread the virus. We have suspended out-of-state travel for state employees. We're encouraging everybody that can work from home to work from home. And if you are a business that it is possible and you are not allowing it, you need to do it, and you need to do it now. If you are a call center and you keep having people come into small cubicles next to each other, you are not doing your part to fight the coronavirus. Make sure, especially if people can work from the phone or from a computer, that you are allowing them to do this. This is your workforce, but they're my people too. And if it is humanly possible to let them work from home, especially with all of the child care options shutting down, I need you to do that. That is your duty as a member of the Commonwealth. And every time that there are folks that won't do what's recommended, it makes us take further steps. We don't want to have to do that. We want everybody to do what's right because it's right, not because it's mandatory. We have closed our senior centers. Again, a hard step, but a necessary step. State boards and commissions are going to meet virtually. We have followed emergency declarations from the Federal Motor Carrier Safety Administration that allows our hardworking commercial drivers to help. All schools are closed, and all of them have now been allowed to provide non-traditional instruction. Right now, I know schools have been closed at least 2 weeks. We ought to be prepared for that to be longer. We have asked hospitals to cease elective procedures by the close of business yesterday, but folks, this is everybody. This is dentists, this is eye doctors, this is everybody. Right now, in other places in the country, at least in certain places, we are seeing a surge of cases that are difficult for the healthcare system to handle. We need everybody ready. And I know we're getting calls about different groups saying, well, we need these dollars or those dollars. This is the challenge of our lifetime. We must have that capacity. Please commit yourself. If you are a part of a practice that isn't normally associated with the hospital, call your local health department and ask them how you're going to be able to help. We're going to need everybody, and we need your commitment to do it. Don't try to be the person that finds the exception why you can practice business as usual when everybody else are making these sacrifices. We need you. We need you. And the most vulnerable amongst us are going to be counting on us. Now, I know we're going to do it. I know we're going to rise to the occasion. But be the person that volunteers, not the person that tries to be the exception. Child care centers are closing as of the end of tomorrow with limited exceptions. We know that is hard, but it's necessary. We have forced a home isolation on a single individual who tested positive and refused to self-quarantine. We're only at one individual statewide. That shows the type of people that we are. We've issued tips and guidance for anxiety, and we're going to try to have some more age-appropriate video to start tomorrow to make sure that we can continue communicating with our anxious kids that are out there, to continue to provide some advice on structure. And our goal is to have that advice that families can watch together at 5 p.m. yesterday about why you still have a schedule and why you're still doing schoolwork, why it is so important. Everybody from the Grand Princess cruise ship is now back home. We are happy to see that. I signed an executive order closing all restaurants and bars to in-person traffic except through drive-through, delivery, and in some instances takeout. We're now going to have the ability to deliver alcoholic beverages in those deliveries as well. I know that was a hard one. And I know there are so many of you that put your hopes and dreams in that and other small businesses that are closing. I promise you that it was absolutely necessary, and by doing so, you are protecting Kentuckians. We have waived the waiting period for unemployment. There's not going to be any job search requirements. We talked about it earlier. Apply for it. We provided a 3-month extension on driver's licenses, and we're going to look at extensions on everything else. If you are on any benefit in Kentucky, any public assistance, it's going to be extended 3 months from when it expires. If your Medicaid, if your SNAP benefits, any of those are expiring this month, next month, they're going to be extended for 3 months. Don't call, and I mean it nicely. Don't call because we're needing to sign other people up. That's just being a good neighbor. We got you. you don't have to file for that extension. We've applied for the SBA Economic Injury Disaster Loan. We believe that we will get a positive response from that. We pushed off our primary elections until at least June 23rd. We've closed government buildings to in-person traffic. We signed an executive order about all public-facing businesses that include gyms, entertainment and recreational facilities, exercise facilities, hair salons, nail salons, spas, concert venues, theaters, and sporting event facilities. If you fall in those, there aren't exceptions, folks. Even if you service one person at a time, there can't be exceptions. We're at this point in this Commonwealth, in this country, where we need you, and we need you to be the person, even though it's hard, that understands that it's your duty and doesn't look to be the exception. Acute facilities should be discouraging all visitors at this time, except for end-of-life circumstances. Psychiatric facilities ought to be restricting visitation. Senior facilities and intermediate care facilities should limit visitation only to end-of-life care. We've got adult daycare center guidance that requires closure at the end of tomorrow. We have again announced that we're going to extend any benefits for 3 months. We've suspended all charitable gaming licenses. I know I said this yesterday, and some people out on social media have made some light of it, but bingo halls have to be closed. And I know people love their bingo. I grew up in this state. But it is a place where this virus would be spreading. Again, it's absolutely necessary. We have talked about banks and how there needs to be no run on our banks. They are going to be okay. We just need to do those services remotely or through those drive-thrus. And finally, our groceries, our food chain is safe. We're not going to run out. We've been assured by those systems we are not going to run out. Shop for a week. Don't shop for a month. That makes sure that there is enough for everybody else. All right, some new things today. We are clarifying one of our earlier orders to say that all gatherings where people would come together are closed. That is, with the exceptions that we have already put out there about certain businesses, about industries, but any type of social gatherings we can't do. And that also includes, and it is not limited to, it includes all type of government gatherings, all types of festivals, but I do think we need to be clear that it also includes our houses of worship and their services. I'm a person of deep faith. I'm a deacon in my church. It's not an easy decision, but it is an absolutely necessary decision. I've always believed that God gives us wisdom, and that going to church in a time like this, when we know it could be spread in any gathering, not just a church gathering, is not a test of faith. I've asked one of my friends, he's Pastor Cory, who is the pastor at Burnett Baptist, to come up and to talk a little bit about this from his perspective. Cory?
Good evening. I have been inspired by men and women who lead faith communities across our Commonwealth as they have done the best that they possibly can to practice adaptive leadership as we have faced this unprecedented crisis. Men and women of faith are following the excellent leadership of our governor, and we are complying as best we can to cease holding gatherings as we want to do our best to mitigate against the spread of the coronavirus. We believe that our governor is leading with excellence, and it is wise to ensure that we are not spreading this virus to individuals or those who may be carrying the virus. It does not spread the virus to other people. And our faith community is doing the very best that we can in order to make church happen, but make church happen in creative ways. This includes online worship. This includes Zoom meetings and Zoom small groups. This includes conference calling. This includes every other method that we can employ to ensure that we're practicing social distance while also remaining connected. Just because we cannot gather does not mean that church stops. People of faith, people of every religious tradition, understand the importance of caring for our neighbor, of doing the best that we can to make the world a better and a brighter place. And even in the midst of crisis, people of faith are finding outstanding ways to continue to spread the message of hope, of faith, of love. I've talked to friends from a variety of traditions, and it is simply amazing the ways that they are finding to do ministry, and how churches and synagogues and mosques are expanding their reach through the mediums of modern technology. I would call on all of my fellow clergy persons to please hear the wise words of our governor, of national leadership, of the CDC. Please don't put seniors and other vulnerable populations at risk. We are called upon to walk with people in some of the most sensitive and vulnerable times of their lives. We don't want to create environments where people have to experience more of those very sensitive and vulnerable moments. There was a day when a lawyer asked a carpenter from Capernaum, what is the greatest of the law? And that carpenter responded to him that the greatest commandment is to love your God with all of your heart, with all of your mind, with all of your soul. And then he said the second is like unto it. It is to love your neighbor as yourself. This is a time where we practice loving our neighbors. This is a time where we will for our neighbors what we would want for our families, which is safety, which is health, and ultimately to emerge from this crisis with as little social devastation as possible. In the faith community, we can make this happen. We can stand behind our governor, and soon enough, we'll be able to resume those wonderful gatherings where our faith is attested to. Thank you.
Thank you. So while this applies to in-person gatherings like a live service, obviously streamed services, contacting your local radio station, especially for some of our rural congregations, anything on TV, all of that isn't just allowed, it's encouraged. And it's something that helps and will help people to get through this. Also, I know our churches are anchors in our communities, and they provide so many other services. If you and your church are putting together meals to help kids that might not otherwise get them, if you're bringing them to seniors from your church that you know would otherwise get them from the senior centers, obviously keep doing that stuff. We need you to. And we need you to take a leadership role in doing that. But the actual gatherings where we get large groups of people together, or even small groups of people together, we can't be doing that anywhere as we move forward if we want to create the types of protections we can for the most vulnerables. We announced we will have guidance on our website about the ability for restaurants and bars to deliver alcoholic beverages. There are going to be some specific limitations or requirements on it. The new guidance on gatherings is part of a executive order signed today to make sure that there is clarity. And I believe that those are the additional steps that were taken today. So with that, I want to make sure that we get to questions. We're going to take questions a couple ways. We've got individuals that are here, and we've got questions from both reporters and from individuals that are at home, and we're going to take as many of them as we can before I lose my voice. Yes.
Your reaction to the legislature's decision not to adjourn, but instead scale back work hours. They're going to come back March 26th and then hopefully vote on a budget by April 1st. I know you suggested that they either vote on a budget now or adjourn and go back to a special session.
So the question, and it was a little more specific that I'm going to re-say it, because the great thing about you at home is if I don't like the question the reporters here asks, I get to say it in a different way and then answer. But it's about the legislature and their decision to stay. Let me just say that I'm extremely disappointed in the version of the budget that we saw from the Senate last night. We are in the middle of an international pandemic where people's health is on the line. And what I saw in that version of the budget was a cut to Medicaid, which we are going to have more people on than ever. What I saw was a cut of dollars to make sure every child is signed up for Medicaid. In a national pandemic, don't you all think every child should have health care? I do. What I saw was a defunding of our teachers' health care for the next couple of years. Folks, we are not in a business as usual. I mean, we are in an American people versus the coronavirus, and we cannot make those types of decisions, and that's being a bad neighbor. The other thing that I saw is just not buying into the fact that I believe right now there aren't Democrats and Republicans, there are only Americans, and our duty is to respond to the coronavirus. What I saw in that budget was an attempt, now that people can't come into the Capitol or the annex, to get back at political adversaries, meaning specifically teachers. It is mean and it is wrong. And we are at a time where we need people to be nicer to each other than they have ever been. We're at a time where people are on edge. And the fact that we wouldn't pass a budget that tries to take care of everyone, and the fact that we would be hearing laws right now that get people agitated, that's not leadership. That's taking advantage of a situation. You know, I've put my dreams as governor on hold. And in fact, I've had to make decisions that, listen, I know they've impacted you watching a lot more than they have impacted me. I'm a governor that ran to create opportunity, both for everyone in their small business, and a governor that wanted to make sure that we had more educational opportunities for our kids. And what have I had to do? I've had to close more businesses out there than maybe any governor has ever had to. And I've had to ask our superintendents, which all agreed to call off school for a period of time. Why? Because it's what we have to do to beat the coronavirus. And the idea that the legislature would put less money in health care at a time when we need to defeat the coronavirus is just tough to understand. You know, folks, our world is different than anything that you and I have ever seen. And it's critical that we make the right decisions and be there for each other. No more political ideologies, just us getting through this. And our world's going to be different coming out of it. We're going to have to rebuild. We're going to have to restart different things. It's going to look different, but I have faith in you and me. As long as we stick together, as long as we get through this together. But please encourage everybody, whether you were previously the most liberal or the most conservative person, that right now, we don't do that. Whether you were against public assistance before, we got to have it now. This is our time that we have to come together to put all of that aside and to know we have to do what it takes to get through this and protect our loved ones. Here's one other thing about that budget. There are lots of things in there that would limit my authority as governor to be able to move money around to do what I need to do to defeat this coronavirus. I hope everybody disagrees with that right now. And any of these other bills that are out there to limit a governor's power to do this or that, folks, I hope right now you understand how important it is that a governor be able to do certain things. They have been hard decisions. But you know, I've been willing to make them, even knowing the pain that I know it causes you. And we've got to make sure that if we ever face this again, that we can continue to make those decisions. That was a really long answer to that question. Let me go to one here. How are people supposed to get their taxes done before April 15th? We're looking at this. Obviously, the federal government has a lot to do about that, but this is something we are absolutely looking at. I was able to get my taxes done. We are going to publish them. They are going to be so boring, they're going to help each and every one of you all fall asleep at night. Next one. I was wondering if there's a way for workers to report their employers for not allowing their employees to practice social distancing, or if their employer isn't cleaning the way that they should. We have had a lot of people reaching out to the governor's office, you can continue to do that. You can reach out to our cabinets all across state government, to our employers. If you are operating just business as usual from before, and I know most of you aren't. I know most of you aren't operating at all, and I want to thank you for that. I want to thank you for doing your duty. And you know what? People are going to be safer because of what you've done. What you've done is put the life and the health of others ahead of your own economic interests. And I got to tell you what, that is special. It's also necessary. That's where we are. But if you're an employer that is not doing that, you've got to do it. You have got to create that social distancing. Don't be the Pike County bingo parlor that I had to talk about yesterday. Don't put people in harm's way. What are the rules for call centers? Geez, call centers, you ought to have the technology you need for people to answer those calls at home. Above anything else, you ought to be able to have people answering those calls at home. Let's make sure all our call centers do that. Chris.
Early on, you talked about a couple of industrial respirators, if I heard you correctly, that have come in. Are you prepared to give us an idea of how many respirators we have in Kentucky, or how many you may have requested from the federal government for help?
Well, we have requested every single respirator, test, et cetera, from the federal government that we can. But what happened, I believe it was yesterday, or maybe, I think it was yesterday, was an allowance or an opening up of the use of industrial respirators as opposed to just the type of healthcare respirators that are normally required. So we are taking all the steps that we can to get as many of those as we can. I cannot give the people out there a number that we have. But let me say, they call this PPE. We're getting all this new nomenclature, all these new terms out there. Folks, we don't have enough PPE. No one else does either. No one does. This is a disease that didn't exist 3 months ago. And while I hope that everything for that production is ramping up, it's a test of how good we're going to be to each other. That we need those that have those industrial respirators to send them to us. And we'll give you the way to do that. We need to make sure that our frontline healthcare workers are as protected as they can be. But I will tell you that every day we have healthcare workers that don't have that full PPE going in and doing their jobs. And to you, thank you. Thank you for what you're doing. You are that hero stepping up at a time where you know it might put you at risk. And without you, we couldn't do what we're doing. We're working as hard and as fast as we can to secure all the resources we can. And I hope on the testing side we get to the point in the future where we can do that drive-through type testing where everybody could get a test. There are very few places that have it right now, but we are planning every single day on trying to make that happen. Yes?
For the testing, I just have a few quick questions. Did you say the number of tests that have been conducted to date? We don't have the total number of tests conducted to date because they're now being done by so many different labs. And right now, we mainly only get the positives in from others to confirm. We know that number is, I believe, well above 600 that's out there, maybe even more than that at this point. But that number is going to change each and every day. What are the labs specifically that are handling these tests?
I'm going to give you just a basic outline of labs that I know. They come on every day, and we hope that there will be more. And just because I read the name of a lab doesn't suggest that all their capacity is for Kentucky. A lot of them have capacity across the United States. There's certainly our state lab, but as we move forward, we're going to be more of a clearinghouse than a direct tester. There is LabCorp. There is U of L and what they're doing. We've gotten some from Quest. We've gotten some from Diatherix and Gravity Diagnostics, Solaris. Those are the ones I see right now. Again, we only have a couple from some of those. And when we have more labs, there's a difference in timing. How long each test would take as it goes and comes back when it's not done by our lab is out of our hands. It's not ideal either in how long it takes, but we want to see that ramp up as it comes. We still don't have what they call that automatic or through testing that we've seen in a couple other places, but we are working as hard as we can to get there. Yes.
No, I'm sorry, just to the testing. What's the capacity? What's our state's capacity to test right now? How many more Well, our state's capacity would depend on all of those private labs. They would depend on how much of their capacity they provided for Kentucky. Now, our limitations are numbers of kits, our PPE, and what that means is that we've got to work every single day to make sure we're using our resources wisely. So 80% of people out there who get this, you're going to be just fine. You're probably going to have very mild symptoms to no symptoms. And that means what's most important is that our healthcare system is there to help those that are truly sick. It's going to be a test of all of us, even when there are more resources that are out there.
So you know the capacity that we have to people to get tested? Because there are some counties that saw it.
All right, so we've taken 4 questions on this wait. Folks, again, this is one of those things where we have people on the front lines every single day working as hard as they can. And I have limited numbers of people, and I'm not going to take them off the front line to collate some numbers just so they're out there. We are testing every single person we can with the resources that we have, spending them wisely to make sure we're helping the sickest.
Are there any cases in eastern Kentucky?
I don't believe we have had a positive comeback from eastern Kentucky, but let me say this, to any region that says we haven't had it here, you have it. You have it. With so many people being asymptomatic, please do not wait to take the steps that we need to or to enforce the guidance. It is in your community. The more you do now, the better. Okay, we got one here. There are factories or other industrial businesses where production continues with hundreds of workers. Folks, you have to look at doing your business differently. And if you can't figure out ways to spread people out and to do it differently, it'll require more action by government. We want to look out for our people. Do I have any comment on the planned actions of House Bill 647 that would allow the General Assembly to call itself into special session without a call from the governor? After what we saw on at least one version of the budget that would cut health care at a time of an international pandemic, I think it would be a very bad idea for the legislature to be able to come in whenever they want to pass whatever they want. Do I have a response to the proposal in the Senate budget that would withhold $1.13 billion from the teachers' pension system unless structural changes are made? We're at a time where people are already on edge and where, because of this pandemic, people can't come into the Capitol or the annex and be a part of this process. To basically attack folks, to make them angry at a time when we need everybody to remain calm, and to put them in this position is wrong. We are in a time of emergency, and doing this type of stuff is being a bad neighbor, and we got to be better than that. With the announced closure of Indiana public schools until May 1st, will we extend our recommended closure for Kentucky school districts? We closed through the end of next week. People ought to expect for it to be extended. We don't have that announcement at this time. Morgan.
You mentioned you're looking at extending the tax filing deadline. Are you looking at extending the deadline for people to make payments if they need to? And also, should people who have or are filing their taxes expect a delay in their returns given everything going on?
So the question is for some clarification on payment timing and whether people should go ahead and pay taxes who are working on that. I don't have a firm announcement on whether or not we can extend that tax filing deadline. What I know is we are in a time of hardship and that it's difficult, and we're going to do everything we can on it. Please let us have a firm announcement before you rely on that. I have gone ahead and paid my taxes, and everybody who can, please go ahead and do it. If we're going to enter a time of scarcity, every dollar of everybody that has the ability to do it, we'll need. But we'll hope to have more information. It's going to take the federal government agreeing to do some things too. Hairstylists and barbers who are independent contractors are currently not eligible for unemployment benefits. First, sign up for Medicaid. If you have had your business close, make sure you're on that. We are working, and I hope we have an announcement for you next week on this. Once we're approved by the SBA, you can also apply there. Is there any evidence that this can be transmitted from people to pets or vice versa? We don't have the evidence on that yet. Admittedly, we've been focusing on the people. But here's what you ought to do. If your pet is going up to other people, it means you're probably not engaging in the social distancing you need to. And if you are like me and your dogs like other people a lot more than they like you can only get your dogs back from other people if you violate that social distancing. So just like we need to keep our families close and ultimately away from other people, make sure you keep your pet in the same. How many of the coronavirus patients are currently hospitalized? I don't have that number, but it's been about half and half. What we're seeing is a lot of people who, even when they start hospitalized, are able to go home. Yes?
I have a two-part question about housing and
Okay.
regions most vulnerable. California Governor Gavin Newsom said that he expects tens of thousands of homeless people to be infected with coronavirus. First, what are you doing about ensuring that the homeless are secure and safe? And then also, should we expect an order regarding evictions, making sure that people aren't evicted from their homes during such an untenable time?
The question is on evictions and whether or not they should be going on right now. The answer is no. We've worked with at least one county on that. Let me just say to everybody out there, eviction should not be going on right now. With the time we're going through, hopefully you wouldn't need an executive order for people to follow through with that, but we'll take the action that we need. Don't throw anybody out of their home right now. We're living through very different times. Be a good neighbor. Understand, even if that's a process of government or even a process of business, we're not living through normal times. Think about the impact of your actions on everybody else. That's where we got to be, because just because we can't be close to each other doesn't mean our actions can't hurt each other. And we need our actions to help each other every day. Going to be tough. It's tough on us emotionally. It's tough on us physically. And it requires us to be really, really good people and good public servants every day. Is Franklin County case associated with state government? That's our person that tested positive in Franklin County. I don't think so, but we have had at least one state employee test positive for the coronavirus. We have close to 30,000 state employees. I'm sure that we have multiple with the coronavirus. It just means that we got to practice that social distancing, where even if we don't think we have it because we could be asymptomatic, that we are doing the things we can not to spread it to other people. Morgan.
Are you looking at, or would you even be able to mandate that insurance companies cover telehealth services, especially for things like mental health?
That's a great question. Mandating that telehealth be covered from insurance companies. I don't think we have taken the step to make a mandate there, but what we have done on telehealth, which we didn't announce, is we have loosened the restrictions to basically be able to provide every service possible by telehealth. And that'll be reimbursed by our Medicaid, and we will look at the private sector too. We want that to be encouraged. And with what's going on right now, every single private insurer ought to be encouraging that and loosening their restrictions. And whatever authority we have to make that happen, we're going to, because we need to make sure our people aren't flooding our healthcare facilities. It's going to be a big test of the nervous but the well that just need routine services, making sure that they can get them without going into a facility that has got to be available for the sick. Yes.
Governor, about the executive order related to gatherings, specifically to churches, what, if any, penalties do these churches face if they do gather?
The question is, what penalties would social gatherings and churches were a part of that face? We don't want to issue penalties. And I got to tell you, we're not, nobody's going to be out there arresting people. That's not the right thing to do. The right thing is for everybody to do their duty. And for those that see people not doing their duty, ask them to, but ask them to nicely. You know, I know we've seen in other countries that sometimes you have some yelling when it's on the street and people aren't doing that social distancing. Don't do that. But do ask nicely, because any group that gets together, not just a house of worship, in violation of the order, is going to spread the coronavirus. And what that does is it puts our most vulnerable at risk, and I know those are folks we love. Okay.
Are they subject to arrest, just to be clear?
We're not going to do that to folks. We need folks to be willing to do this, to be willing to take the right steps. This isn't going to be a heavy-handed approach. It's just about people's duty, and I'm putting in the order to make it really clear what's expected from everybody. Okay, we've got, I just want to confirm that the problem is we only have a few labs in Kentucky, and they don't have the capability at this point to scale up testing. What is the largest number of tests that each lab has run on a given day? So we only have our state lab that I have those numbers for. I think we've run 37 or right around 37 on our largest day. Some of these industrial labs like LabCorp or commercial labs, I think they're called, run a whole lot on any given day. All right, in the back.
Will you be waiving or altering the salary requirements for people that need to sign up for benefits?
The question is, will we be waiving the salary requirements for people who need to sign up for benefits? I don't believe we have done that yet, but as we move forward, we got to look at everything as we go. I know there's an issue with those that have worked in restaurants and bars about their compensation versus tips. That's something we got to work at, and we've already reached out and are reaching out to the federal government to address it. You know, right now we are seeing the inequalities in a lot of these assistance programs, and they are needed now more than ever. And what I want to help Kentuckians get through this is to have as many people qualified and signed up for them. This is about us making it through. We will rebuild. We will create that bright future once we're through, but let's make sure everybody has enough. Let's make sure everybody can get through it happy and healthy. Let's make sure we protect our most vulnerable. You know, today I had to announce our second death here in Kentucky. And I'm always going to try to be as transparent as we can. I'm always going to try to keep us as calm as we can. But we're dealing with something really serious. And we don't take it seriously. Those we like and love are put in harm's way. I'm going to take two more.
Doug Thurman, the CDC field officer assigned to the state's public health department, said on a call with clinicians today that there has been at least one incident of a healthcare worker getting COVID-19 from a patient they treated. Can you provide any info on where that case occurred and what that person's status is? And also, have you had any reports of, frontline healthcare workers who have tested positive?
The question is based on a call I wasn't on today, where an official said that we have at least one frontline healthcare worker that may have been diagnosed with the coronavirus. I don't have that information. We'll provide it tomorrow. I'll get that information for you. Now, we will have frontline healthcare workers that ultimately get this. And some of them will get it because we've asked them to work, even at times when there is not enough, whether it's PPE or that we don't know that person has the coronavirus. And this is how special our healthcare workers are. Again, this is a time like none of us have ever lived through, and we're up against an adversary that none of us have ever dealt with. And people are walking right in to that danger that we face to do the right thing and to take care of people. There will undoubtedly be those that sacrifice to help us that come down with it, and we're going to take care of each and every one of them. That's why we're providing benefits, and I know that's just a small thing, to any individual that might have to self-quarantine through that. And I know we've had healthcare workers, certainly, that have had to self-quarantine but have not tested positive. Last question.
Governor, we had some state workers reach out to us, and they are concerned. One said that they were told that if they can't prove they have work to do at home, they will not get paid if the office is closed. Is there any? Can you talk about that?
The question is state workers who have called in and they're being told by their supervisors that unless the office is closed, they won't get paid. Yeah, I'll fix that. Every state worker who can work from home should be allowed to work from home. I know we're going to create schedules where in some places we've got to have some people coming in. What we're going to do is we're going to thin those out. But wherever it is, if offline you want to tell us, we'll fix it. Now, government doesn't always adjust quickly. Those that have covered government know that sometimes it adjusts slowly, and sometimes the governor has to hear about things to fix them. You can tell those employees that we will fix it.
So even if they can work, maybe they can't do their job from home, but their office is closed, those people can still...
Well, if folks in state government have an office that's closed and are at home, no, we're gonna make sure that we are still paying our state government employees, and we're gonna be repurposing them too. We, for instance, have more unemployment claims than we've ever seen. It's gonna sound strange. Keep them coming. Keep them coming. We want to help each and every one of you. We're going to repurpose people to help there. And so I think our state employees that are out there that don't have enough to do, that are at home, that are being told that there isn't work for them, I got work for them. You know, with what we're facing, it is an all hands on deck. All right, so I know we're a little over an hour. Kentucky, we're going to make it through this. The news is probably going to get a little tougher each and every day until it starts getting better. Let's be prepared. Let's be resilient. Let's talk to our family members about what's going on, but primarily let's be committed. Let's be committed to doing our duty as members of this Commonwealth and our patriotic duty as Americans. This is our challenge, and I know we are up to it. Follow the guidelines, be a good neighbor, be kind to each other, but ultimately stay away from each other with that 6 feet plus of separation. It's going to be a challenge to our physical and emotional health like none we've ever seen, but we can do this. Remember, while we haven't seen it in our lifetimes, this state and this country have been up against so much, and we have always come out on top. We are all in this together. We will win together, and we will protect each other together. Be a good citizen. Follow the guidelines. I'll see you again tomorrow at 5 o'clock. Thank y'all. Thank you. Thank you.